first death of a patient in the U.S. with monkeypox has been reported. Anjalee Khemlani is here with the details. Anj.
That's right, Shauna. Texas Health Department is confirming the report that someone who's severely immunocompromised has died, and they did have monkeypox. Now, it's not clear if they died from monkeypox, and that's something that the health department is currently investigating. An important reminder that of the 18,000 U.S. cases reported, 0 deaths so far, but that doesn't match what we've seen globally from this variant of the monkeypox that's circulating. So far, 48,000 cases with several deaths in non-endemic areas, including Brazil, Spain, and India. So it was really a matter of time before we might see one onshore, but more details to come.
Well, thank you for that update. And Anjalee, we know that the Department of Health and Human Services also holding a meeting today to plan for the end the government payments for COVID-19 shots and treatments. What do we know so far?
That's right. So we don't have the details of the meeting just yet, but we know that this is a planning session, and drug companies, pharmacies, and insurers have been invited to discuss the idea of the commercial market of COVID vaccines and treatments. This is something that the vaccine companies in particular have already noted was the transition they are aiming for, telling us that they will prepare or were preparing for a 2023 commercial market. But we know that the White House COVID-19 response team coordinator, Dr. Ashish Jha, had noted before that transition is going to be happening this fall. Now, a clue as to what is in store lies in a notification from the health department on one of the treatments, that is the monoclonal antibody by Eli Lilly, has already started to transition into a commercial market as of August 15th. They did note that the healthcare providers were going to be able to continue ordering from the government for about a week. They had about a week's supply, but then after that, they would have to directly order from AmerisourceBergen, the sole provider that was working with Eli Lilly. So that might be sort of what we see in terms of commercialization. Now, the question still remains, of course, who will be paying for this out of pocket? What will the out of pocket costs be for Americans? And what will be the fate of uninsured individuals in the U.S.? And those are details we're still waiting to hear. Now, all of this, of course, culminates in what we see as sort of the outlook for the pandemic. And I spoke to Dr. Anthony Fauci earlier today discussing that, and specifically, his thoughts on just how this has panned out and what to expect. Listen to it.
We thought we were ready for this pandemic, and we were judged by independent organizations that the United States was the best prepared for a pandemic. And yet, when you look at what happened to us as a country, we were as severely or more severely hit than many, many other countries. And the deaths per million population in the United States is higher than any country in the world.
So as you can hear, the U.S. didn't fare as well as we could have and should have, considering the resources. He didn't sound too confident that we're ready just yet for the next pandemic. Back to you.
Indeed. Well, a big thank you there, Anjalee Khemlani. Thanks for joining us.